It's time to see what ideas parents have come up with to take forward to improve our service. And the first thing we'll have to do is review each suggestion, then prioritise, decide what action is going to be taken, who's going to take a lead on it, and how they're going to carry it out. Does that all sound okay?
Yeah, but no matter what we decide, I think that we need to get back to each parent that made a suggestion. I mean, there might be things that we can't do, but we still need to feed that back to them.
No, you're right. Yeah, we do need to make sure that they know we're taking them seriously.
Yeah, we can have our own "you said we did" board, so then they can see clearly that we're taking their suggestions on board.
Mm-hmm. Okay, great. Well, let's see what they've come up with.
Meal times are a huge strain in our family, and I believe if CAMS could just give us a bit of support with that, it would help to keep our daughter out of hospital.
Well, I think that's a valid point. We need to look into it further.
Well, it'll obviously put a strain on our resources.
But it's important that we recognise that it's a need.
Yeah, I agree. I mean, I've heard parents say this kind of thing over the years, and it is a huge worry for them, especially if their child is not eating.
Okay, so we're agreed that we need to look further into the possibility of that one, yeah?
There must be an easier way to explain what outcomes measures are and how I can support my son to achieve them.
Well, I like to think that all staff are confident explaining outcome measurements to parents and young people. But maybe we need to gauge what support they need to ensure outcome measures are explained in a reasonably consistent way. Matthew, can you look into this?
Yep.
It'd save time if I could pick up a phone and discuss my son's difficulties and get support, rather than have to tell someone and for them to do the referral, because essential things get missed out and it takes too much time.
Well, I think we need to push ahead with the self and family referral.
And we need to make sure that the language is family friendly.
Oh, yeah, definitely. Can you take a lead on that, Kath?
Yeah.
We have this meeting called a care programme approach. At first, I didn't really understand what that was about, and nor did my son. But after lots of encouragement and just being able to talk it through so it really made sense to us, we've been able to really own those meetings. So my son is very much in the driving seat of those meetings. And as a result, it's really improved the communication between the different professionals and the support that we're getting, and also the goals. So it's been really, really helpful.
There's lots of new information about how the brain develops in teenage years. It'd be really good to get more information about that and how we can best support that. Things such as decision making, risk taking, consequence. After all, this is what we're experiencing, and it'd be good to know more about it.
Well, there's a growing body of evidence in relation to this. Maybe we could post information on a website, including strategies for how parents might be able to think this through.
Yeah, and maybe we can do an information evening for the parents.
Mm-hmm.
Yeah.
It would be really helpful if we could be involved in the pathway developments. We could identify key areas from a parent's perspective. Also, what alternative support might be available. Technology could be really useful in building resilience.
It would be useful if we could meet with senior managers and commissioners and discuss the strengths and challenges of CAMS.
So these are points I can raise with the commissioners at the next service review meeting. They've asked previously about parent involvement, so it'll be interesting to see what they've got to say.
It's the whole hospital thing. It's not just the distance getting there, the parking. It's the fact that it's a hospital. Some people are okay with that, but I think there should be other options, places, times when I can take my child for an appointment. Maybe there should be twilight, early evening appointments, something like that. And as far as venues go, you could use medical centres, schools, community centres, youth groups, churches. We've even got counselling rooms at our church. Yeah, there's so many more options that should be available.
The complaints procedure is just not that friendly. If I'd have had more of an opportunity to discuss the difficulties, there would have been absolutely no need for me to complain.
It takes good levels of communication to support working together between CAMS, my doctor and the school and other services involved, and that also means communicating with me, the mum. Can we work more together on this?
Well, this definitely shows the importance of good communication. I think if we can get this right, it will certainly improve the sense of satisfaction in the service.
I went to a meeting and the CAMS worker asked if anybody would be interested in working with CAMS on the development of a range of policies, things like confidentiality policies, sharing of information and marketing materials. So I volunteered along with another parent. We both work in that type of areas, so we've got the range of skills necessary. But neither of us have heard anything since that meeting, and it is quite a while ago now.
Can you look into this one for me, Matthew?
Yep.
Talk with us about ways we can build resilience for our children and our families. I have searched a lot of websites which help me a great deal. I would gladly pass them on to CAMS if they would like to give them out to other families.
Well, from my experience, many do have ideas that can help other parents.
A friend of mine has a review every 6 weeks and I would really like to do that. I think it would be really useful to get together with my family and the specialist practitioner to discuss the progress and where we go from here, and I think it would be a really good thing to do.
Well, I think these really show how important it is that parents and families are involved in helping their child bounce back, and we can play a part in this.
Yeah, and we need to support them in how they can develop their resilience.
Yeah, I think we're all agreed there's some really good suggestions there, and not many of them that actually require a lot more resources.